നമസ്കാരം യുവർ ഡോക്ടറിലേക്ക് സ്വാഗതം. ഞാൻ ബിൻസി. എൻ്റെ കൂടെ NMC സ്പെഷ്യാലിറ്റി ഹോസ്പിറ്റലിലെ ഡോക്ടർ ഉപേന്ദ്ര ഷാ ആണ്. ഉപേന്ദ്ര ഷാ ഡോക്ടർ സ്പെഷ്യലൈസ്ഡ് interventional cardiologist ആണ്. ആൻഡ് ഇന്ന് നമ്മുടെ കൂടെ കുറേ ഡോക്ടർ ഭയങ്കര എക്സ്പീരിയൻസ് ആണ്. ആൻഡ് നമ്മുടെ കൂടെ ഹാർട്ട് റിലേറ്റഡ് കുറേ പ്രോബ്ലംസ് നമ്മളോട് ഷെയർ ചെയ്യുന്നതായിരിക്കും, നമ്മളോട് ഡിസ്കസ് ചെയ്യുന്നതായിരിക്കും. നിങ്ങൾക്ക് എന്തെങ്കിലും ഡൗട്ട്സ് ഉണ്ടെങ്കിൽ വിളിച്ച് നിങ്ങളുടെ ഡൗട്ട്സ് ഒക്കെ ക്ലിയർ ആക്കാം. വിളിക്കേണ്ട നമ്പർ TV സ്ക്രീനിൽ അറിയുണ്ട് 0529462343. Welcome to your doctor show, doctor.
Thank you.
So doctor, as I said, doctor, you are dealing with heart diseases. So I just want to know which is the common cause of death.
Commonest cause of death world over is heart attack, and that is because of the blockages in coronary artery. In a medical term it is called as a coronary atherosclerosis, and so is true even in the UAE. Commonest cause of death till today is the heart attack.
Okay, and what are the common way to recognize coronary artery blockage?
The common ways of recognizing coronary artery blockages is the patients have certain symptoms or the presentation signs what they are having, mainly chest discomfort, chest uneasiness. Many times the people in the local language says the घबराहट होती है. So this is the word which one has to really pay. Many times they may not have a chest pain, but chest discomfort is a very common problem. Along with there may be sometimes sweating, vomiting, and once this type of symptoms occurs and it lasts for 5 to 10 minutes, patient is particularly expected to consult his doctor, and doctor should then consider the investigations and make sure that this chest discomfort or chest pain which patient is having, is it related to the coronary artery blockages or not. That is the most important things which one has to really pay attention to as a patient. One most important thing I would like to really emphasize, 50% of the heart attack comes as a gas problem or the indigestion problem. Patients sometimes thinks that these are all gas or indigestion. Even some of the doctors also sometimes when they suffer, sometimes they also make a mistake and then they think that this is a gas. So it is important to know that even some unusual gas disturbances or indigestion problem, along with the chest discomfort or uneasy feeling, person has to pay attention, their relatives have to pay attention, and please don't neglect it. Majority time the people neglect it or just take it as a gas, and then they'll end up in the major problem. So this is what people have to realize, that chest discomfort, the upper part of the stomach discomfort, along with the some indigestion or something, if at all, may be sometime a symptoms of the heart attack. So one has to realize, not in every patient of the gas disturbance has, but this one people have to realize.
So is there any age, like what age one should undergo this type of discomfort, or is there any age special age for heart checkup or anything like that?
See, before 3 decades, if you see that we used to see the heart attack problems at generally around 50 years of age or 60 years of age, not earlier. But of late now, particularly after 2000, incidents have really increased, and we all are seeing the patients with the heart attack even at younger age, and I will not hesitate to tell that even some of the patients are even the 40 or below, and some of around 30 also. Youngest patients which I have done the angioplasty is a 26-year-old.
26.
Yeah. And for your kind information, that Today only I have done one patient, he is on 31, his angiography I have done. So there are younger patients who are coming with the problems, and so younger age is not a bar to have that cannot have the coronary artery problem. So people have to start little realizing that and be little careful in really accepting as a this can be a chest discomfort. They have to be ready. It is not that it is the no more as a disease of the elderly, though majority of the patients are in the around 50s and beyond, but still a sizable number of patients are below the age of 40, and
40.
that is fact.
So what you said is after 2000 we are seeing the number is like reducing, the heart, the age is reducing.
Age is at younger age, patients
we
are
are
developing
getting
a heart attack.
So
That
what
is
will be the reason for that?
See, the commonest risk factors for the heart attack or the coronary artery blockage, in the medical term we call, or in the simple language, heart arteries which are getting blocked. The risk factor for that, those who have got a high blood pressure, those who have diabetes, those who have a high cholesterol level, particularly those who are smoking and obesity and inactive life, and of course the stress which is now universal,
Very high.
very high
Yeah.
in the world of competition. So these are the patients who, if have this any problem, they can have a heart attack maybe at a younger age. Particularly if anybody in the family has a heart attack below the age of 45 years,
History like
history, any other family members have a heart attack below the age of 45 or 50 years, that they are also more prone or susceptible to get an attack at a younger age.
So these are the common things, like it could be a chest pain, but you have to go and do the checkup. Otherwise, maybe it could be a chest pain or a gastric problem. It could be a heart attack. So it's better to go and do the checkup. So I just want to know what are the tests to be performed to detect the heart artery blockage is there or not?
Before I come to the answer of that one, let me tell you one very important thing. Many times we have seen that patient goes to the doctor or the clinic or the hospital and they say, doctor has done these all investigations unnecessarily, kept for 4 hours, 6 hours, and then nothing. It is not that the doctor, medical faculty are not aware of that we are aware. Nobody is doing unnecessarily. But when anybody comes with the chest pain, when doctor does some investigation, he knows, and medical faculty knows, that probably out of 10, 3 or 4 may be having a heart problem, or 2 may be heart problem, other may not have a chest pain related to the heart. But just to pick up those 2 or 3 patients at the right time before the damage occurs, we have to investigate that all 10 patients. Means 20 to 30% of the incidence of the chest pain may be the coronary. To not to miss that heart problem or heart attack, we have to investigate everybody, and those who after investigation does not have, we say okay, this is a non-cardiac chest pain, and investigate for the other cause of pain. And those who have got a heart problem, we immediately diagnose it early before the damage occurs and treat it. So remember, people should not be under the wrong impression that doctors are unnecessarily doing. Doctors themselves know that probably 20 to 30% will have the heart attack or something, remaining may not have it. So this people have to understand that to find out those patients of the heart problem, we have to investigate in everyone. We cannot really leave it, and we cannot accept missing a heart attack.
That's true.
That is why. So
it's a detailed study.
Detailed study is required.
Okay. So we'll go through a video now. So okay, before that we have a caller with us. Let us see who's that. Hello.
Hi.
Hi, you're Dr.
Hi.
Lakis.
Can I speak to doctor?
Yeah, you can speak to doctor.
Yes.
Yeah. Tell me your name.
Doctor, my name is Sadashivan.
Sebastian. Okay, Sebastian, you can ask your doubt to doctor.
Okay. Doctor, I'm working in a supermarket, and if I have seen somebody got chest pain or that kind of symptoms, what are the first aid I can given to that that patient?
The first stage you just want to know.
see, chest pain is there and is the severe pain and is unusual with discomfort, patient can take a tablet aspirin, that is the best, and then he should reach to the doctor and take the advice of the doctor, and doctor generally will, after examining, checking his BP, heart rate, will take an heart examination, will do the ECG, and then definitely doctor should will perform further test according to the whatever the investigation shows.
Okay, doctor, how I can assume is this something related with the heart attack or chest pain? How I can easily identify? What is the main symptoms?
Yeah, okay, very good question. Main symptom is generally the chest discomfort or the uneasy feeling occurs, okay, in the center part of the chest. Sometime pain can be radiated to the left hand or sometime even right hand or left or right shoulder. As I already told previously, sometime the gaseous disturbance may be there in the upper part of the stomach as well as the part of the chest. If these symptoms are there and if patient many times feels that this is unusual and there's
one more. Yeah.
Yeah, one more doubt. Okay, yeah.
Yeah.
Ask.
One more doubt. See, I have seen many videos like, if this kind of things happen, people are pressing on the chest, giving artificial air. That kind of any exercise need to be done if I identify this kind of thing.
Oh,
What
he
he's
means
asking?
He means giving.
Yeah, doctor. I have seen many videos. Like if people got heart injury, heart attack, people are pressing on the chest, giving artificial breathe. These that kind of exercise need to be taken.
That you are talking about those who patient as the cardiac arrest occurs, then only. These are not we are not discussing those who patient develop the attack and suddenly the heart stops, then only to be done. What we are talking about cardiopulmonary resuscitation, we are not talking at present. These are the patients who have chest pain and comes over there, and if they go there, that's why I told you they have to immediately go to the doctor, either in the doctor in the clinic or in the hospitals nearest, go to the emergency and at least get an ECG and let the doctor examine and then decide. That is the best way I can tell you. In meantime, if suppose he has got an aspirin, then he can take an aspirin, provided there are no contraindications or no bleeding history from the GI tract. Okay, fine. So he can that.
Okay.
So hope you got
Okay.
your answer. Okay, thank you.
Thank you.
Thank you very much. So actually he was more about heart attack, like
He was talking about the heart
asking
attack.
heart attack.
Yeah,
and
fine. That's
what
why I
else.
said that aspirin is a very immediately, if anybody thinks aspirin, people should take it and reach to the hospital and then let the doctor investigate you what exactly this pain is due to, whether attack or it is not because of attack. Now very important things which you were asking me, that what are the tests we do. The tests are for the important tests are done after examination. The ECG, electrocardiogram, doctor does. Then second is done in the chest pain is the cardiac enzyme nowadays, which is I think people should know. And the cardiac enzyme is one test where even the small micro level of the attack is there, which is not being picked up by the ECG, can be picked up by the cardiac enzyme. And in that case, this cardiac enzyme means they are released in the blood because of the heart muscle which is getting damaged because of the small attack. Now that small attack cannot be picked up on the ECG, but even before ECG shows the full-fledged attack, the micro attack, heart attack, can be picked up by this cardiac enzyme. And nowadays many of the patients, whenever chest pain they are having, many doctors ask the cardiac enzyme apart from the ECG, and that definitely tells. Another important thing is that many times the heart attack may not be picked up in the first ECG or first cardiac enzyme done. serial level of ECG and cardiac enzymes to be done, maybe after repeat after 6 hours, first set, then 6 hours, and maybe another one another 6 hours. So then sometime the first ECG may not show, second or third ECG may show, sometime the first cardiac enzymes, mainly the troponin I, creatine kinase and creatine kinase MB iso enzyme. These are technical words. For common people, cardiac enzymes is better to remember, and if they are done maybe first time after 6 hours, second time, and another 6 hours after the third time, and if they are normal, chances that person is having a heart attack going on is less. He may be having a blockages but not culminating into the heart attack. Okay, so what we are talking about the heart attack. So these are very important tests. So ECG and cardiac enzyme, and to be done serially. Okay.
And what is echocardiography?
Yeah, sometimes we take help of an echocardiography to detect the heart attack also.
We will go with a video with that, so
Yeah.
that will be easy to explain
Explain
you.
the-
Yeah,
yeah,
so
fine.
we'll show you a video, and that is echocardiography.
Echocardiography is just done. Here you can see the heart contractility, heart muscle. There are different angles which we take the images of the heart. This is called the short axis view, where we see the pumping vein center. The round things which is there pumping is the main pumping chamber of the heart, and that shows us the pumping of the heart. If any part of the heart where the blood supply is less will show the less contractility, and the overall pumping will be less. So this also sometimes is very important investigation to know whether there is any blood supply which is going less to the heart. Echocardiography has now become widely available, and it has become a part and parcel of a clinical evaluation of a patient with a chest pain. Okay, so ECG, cardiac enzymes, and echocardiography, these are the three more investigations, three important investigations. Of course, there are so many further investigations which we have to do.
3-level approach?
Yeah,
for this?
3-level approach is a generally what I call always a 3-level approach. Is a one is a clinical examination, ECG, and a blood test.
Okay.
Second comes the echocardiography, and of course with the acute pain the treadmill is not to be done. These are in the stable patient, not in the where the patient we are suspecting heart attack, we don't do that. And the third level comes the angiography. So these are 3-level approach. Many times we have to really even take the patient for an angiography to make sure whether patient has coronary artery blockages or no. I always call coronary angiography is a mirror,
Okay.
because as a patients and their relatives, they want to know whether a patient has anything to worry, does he have any serious problem or not. Many times this ECG, cardiac enzyme may not show, or if they shows definitely any positive, then certainly with the patient with the chest pain will go for the angiography to make sure how many blockages are there, how many percentage blockages are there, and how many vessels are blocked.
So
Okay.
first, if we are going for any test, first we go for ECG, then cardio enzymes, then echocardiography, then
If there is any doubt
angio-
and doctor feels, then definitely many time doctor advises and the cardiologist perform the angiography, and that is a, as I told you, it is a mirror where the picture will be clear. And one always over a period of experience we all realize we don't presume anything. We have to really see what exactly patient has a problem or no problem. So angiography is a very important investigation to make
Investigation.
sure whether patient has any coronary artery blockages or not.
Yeah, so all this while we discussed about if you have any chest pain, don't take it lightly, take it seriously only, go to the doctor, go to the clinic and do all the tests. If they, it may be a gastric problem or it may be a heart attack. And secondly, we discussed about the 3-level approach. And in 3-level approach, there are clinical and
The clinical examination along with the ECG and the blood
ECG,
test.
Blood test.
The second level is an echocardiography, and
cardiac.
third level is the angiography. That is how the 3-level approach. Many times the 2-level may not show, and angiography may show blockages. It may be reverse way, when the initial impression that there is a blockages, but when we do the angiography, things may be clear. So both the way possible. That's why I always say that we don't presume anything. and over a period of experience we realize that we have to completely investigate the patient and then take the things as it is.
As it is. So we already showed how we do the how doctors do the echocardiography. So now the second video we show is the coronary
Angiography.
angiography. So we'll have that video and doctor will be explaining that.
Yeah, what you are seeing, the some trees like the branches like going on is what you could see. Generally heart is there. When we do the x-ray we cannot see the coronary arteries. Coronary arteries mean the heart arteries which supplies blood to the heart muscle. For to see that heart arteries, even echocardiography cannot see the heart arteries. Indirect information can be there. For that, visualizing the blood supply to the heart and to see the heart arteries, the test is the coronary angiography, which you are able to see now. When the beating heart is there, and then for that to reach to the heart, one passes the catheter, that is a plastic tube, either from the groin arteries or from the right hand arteries or the radial arteries, what we call, and then we reach towards the heart, where you can see the tip of the catheter is there, and from outside we give a radio opaque contrast media, okay, which visualizes the coronary arteries, and then we can make out the blockages, as in this patient has got a 2 vessel blockages or multiple blockages over there. So this is the final gold standard answer whether the patient has blockages or no blockages.
So here it is clear that patient has
yeah,
blockage
in this patient it was very clear that he has a blockages in the coronary arteries.
So
and
this is the final test.
Confirmatory gold standard test, what we call.
Okay, so this is coronary angiography which you have to do for the final test. This is the final test. After that,
another thing which I would like to tell you, if you permit, the coronary angiography is done once the patient gets admitted to the hospital, because this angiography facility is available only in a few centers. It is done under the local anesthesia. Generally the patient's concern is there, are they going to make any cut or any stitches? By and large, no cut required, no stitches. It is done under local anesthesia, and just one puncture, just like one injection, person will get a local anesthesia pain. That's all. Another thing is, patient is lying down on table and he will be talking to us. He will be watching the on the left side of his TV, his coronary angiography picture. He can
view it.
Yeah.
Oh,
when we are working on the heart, this is amazing that working on the heart, still the patient is fully conscious and he can talk to us, and then we can take the picture of the angiographies. So it is a coronary angiography is a test, and it is done when the patient is fully awake under local anesthesia. It is generally takes 30 minutes to 45 minutes, and once the angiography is done, then the further decision is being taken whether the 3 different types of a treatment available for coronary artery blockages. One is a drug treatment, second is a coronary balloon angioplasty and stenting, and third is a coronary artery bypass surgery, what we call as a CABG. So after angiography only it can be really decided what treatment patient is requires and which is the best treatment for him.
Okay, so before getting into that topic, we'll just take a short break, but if you have any doubt you can call us on the given number on the screen and you can clear your doubt with Dr. Upendra Shah. He is an experienced doctor, and we were discussing all about angiography, and before that we were discussing about the chest pain and what are the tests which we have to perform and how this all are done. But before that, doctor, we have a caller with us. Let us see who is that. Hello. Hello.
Hello, good evening.
Good evening.
Good
Welcome
evening.
to your doctor.
Okay, my name is Raghunath.
Okay. Yes.
I
Yes.
had,
Yeah, you
I
can.
had a I had my cardiac enzyme tested, CKP,
Yes.
and it is showing around 1700.
Okay.
So is it legal? Should I go for further test? My ECG is very normal,
Yeah.
and other BP is also normal.
Yeah,
Is it
Mr.
a check?
Mr. Raghunath, very good question. if what you have said is a cardiac enzyme CKP you have said, and along with that one should do the troponin I or troponin T and the CK-MB fraction, and after doing that only one can decide that what is the further course of action despite normal ECG. Let me tell you, despite normal ECG. So normal ECG, again very good question you asked. Normal ECG does not mean that person does not have coronary blockages. He can have a severe blockages, however only CPK is not acceptable. One has to do more than CPK, CK, MB fraction and the troponin I or troponin T. And
but is it an indication towards any blockage?
That's why I'm telling you, one has to really do the investigation completely, and then only one should take the things into consideration. What is the age of the patient? What are the risk factor patient has?
60 years.
Yeah, yes, the 60 years. What is the age of the patient? Whether he has got associated diabetes, high blood pressure, cholesterol, whether is he smoking, and again I told you echocardiography, CK-MB fraction, troponin I, and then everything considering whether he has any chest pain or no chest pain, whether other problems, breathlessness, all those things has to take into consideration, and then a cardiologist will take a decision.
Okay, so anyway, it warrants a detailed analysis.
Yes, absolutely correct.
Thank you, sir.
And it was a very good question of yours. I appreciate you.
I hope his doubt is clear now. And as I was saying, we will take a short break, and after the break, we'll continue with Dr. Upen and the same topic. If you have any doubt, you can call us, clear your doubts. So after a short break, we'll see you.
Thank you.